Thanks for tuning back in for Wellness Wednesday. My name is Dr. Chelsea Drda, and I'm one of the 3 chiropractors at the Frank Clinic of Chiropractic in Zephyr Hills, Florida. So, how did things go this week? Did you all do your homework? Was it really easy? Were you really surprised? Did you enjoy it? Or did you have some difficulties? Leave me some comments below and I'll try to address them as best as I can. Just to recap, the basic premise of the paleo diet is eliminating wheat, dairy, processed foods, and refined sugars, and instead replacing them with healthy oils like olive, avocado, and coconut, meat and fish, vegetables, and fruit, all the things that our ancestors would have eaten before we started processing grain. Some of you may be thinking, what's the big deal about this gluten-free thing? Grains make up a large portion of the food pyramid. Here's the thing. The food pyramid we traditionally think of is actually dating back to 1992, and there's been an abundant amount of research in the fields of nutrition and health sciences since then. It's pretty outdated at this point. The CDC currently recommends that grains should make up 1/4 of your plate or less, which is equal to or less than the amount of vegetables that should be on your plate when you're having a meal. Many Americans see that and think, okay, then in that case, I'm okay having this wheat bun with my dinner. Not exactly. Here's the problem. The way that we harvest, store, and process wheat and other cereal grains has strayed away from traditional practices, and as a result, wheat and other grains have become inflammatory to many people. Some researchers believe it's just because the grains develop small amounts of mold during processing. Others insist it's because of genetic modification over years and years and years. Regardless of the cause, I'm not a genetic scientist. I'm not going to argue. We're seeing more and more studies asserting the inflammatory nature of these grains and the negative effect that they have on the body. If we grossly oversimplify the issue, there are 2 very basic types of physical characteristics of people we see with food sensitivities. The first person tends to be very slender, have difficulty gaining weight, experiences hair loss, anemia, nervousness, and other symptoms similar to and possibly including an overactive thyroid. Why? Because her gastrointestinal tract gets inflamed by the things she eats, and it speeds up digestion, so there are more inflammatory chemicals in order to prevent more inflammatory chemicals from leaking into the rest of her body, and as a result, she doesn't absorb vitamins and the nutrients she needs. These cases sometimes can be harder to diagnose because the individuals overall look healthy because they're slender, so nobody thinks that they have a problem. The second person, on the other hand, tends to be overweight, has difficulty losing weight, even with dieting and exercise, and has symptoms too, and possibly including an underactive thyroid, including biological blood markers that show symptoms of obesity, diabetes, and thyroid disease as well. These individuals may also have trouble getting help for the opposite reason, because their symptoms are written off as being part of obesity, fibromyalgia, diabetes, or some other disorder. Individuals in both groups tend to experience acne, depression, anxiety, irritability, fatigue, sleep disturbances, multi-level joint pain, acid reflux, stomach ulcers, abdominal swelling, vomiting, gas, and diarrhea or constipation, or they fluctuate back and forth between both. If you're sitting there saying, wait, why hasn't my doctor diagnosed me with a food sensitivity? It's because there's very little testing that properly identifies food sensitivities. In my last video, I touched briefly on food sensitivities and how they differ from anaphylactic reactions, the traditional food allergies we think of, like peanut allergies. So if you're lost right now, go back and watch that again if you need a refresher. As a whole, medical research tends to focus on food allergies because they are more immediately life-threatening than a food sensitivity, and they're much easier to identify on blood work and testing and from the obvious signs and symptoms that we see. And they tend to be classic across people with food allergies. Food sensitivities, on the other hand, are much harder to study because the symptoms differ so widely between individuals. So it's going to be a little bit harder for your doctor to figure out if you have them, and they don't show up as easily on blood work because they show more generic markers of generalized inflammation. I'm not asking you to take my word for it. Test it on yourself. This kind of experiment doesn't have any kind of side effects at all. And if you think about it, requires very little input and financial investment on your part because you're controlling all of your investment to it. So do an experiment for yourself. Keep tuning in for Wellness Wednesday. See how you feel. Unless you jump right into a strict paleo program right away, it may be a few weeks before you see any change in your symptoms. And that's true even for people who do jump right into plain paleo right away, because it can take gluten and dairy sometimes 3 months to completely exit your body for gluten and 3 weeks for dairy. So give your body some time to do the healing that it needs, okay? So this week, I want you to incorporate 4 paleo meals into your meal plan. You're going to be great. Have a great time with it. Have fun and have a sparkling day, everyone. I'll see you next Wednesday.